Okay, today my name is Jacob Masih and we'll be assessing Gurjan's posture. So right now I'm going to be locating the center of pressure, so I ask Gurjan to put his pressure within the heels, then to the toes, and to relax, and we get his center pressure within the midfoot or neutral. Moving on to the ankle joint, I ask if I can landmark his lateral malleolus, and we obtain 4 centimeters posterior. Moving on to the knee joint, as I landmark, I obtain 2 centimeters anterior of the measurement tape. Moving on to the greater trochanter or hip joint, I ask Gurjan if he can landmark and help us out, and I ask Raj to pinpoint that area, and as I measure, I obtain 3 centimeters anterior. Moving on to the lumbar region, I ask Gurjan if he could pull his t-shirt in front of him so I can get a better view, and as I landmark and measure, I get 11 centimeters posterior. Moving on to the shoulder joint, I ask Gurjan if I can landmark, and as I measure it out, I get 2 centimeters posterior to the measurement tape. Moving on to the cervical region, as I measure, we get 8 centimeters posterior to the measurement tape. Moving on to the pelvis attitude, I ask Gurjan to tilt posteriorly, then anteriorly, and then to relax, and we obtain neutral position. Moving on to the frontal plane, now we're going to go back to our center of pressure, so I ask Gurjan to move valgously, then varus, and then to relax fully, and we get a neutral position. And now we're going to be moving on to the chin area, so as we measure, we notice that it was in line or 0 centimeters to the measurement tape. Moving on to the sternal notch, I ask Gurjan if he can politely landmark the sternal notch for us, and as we measure, we obtain 1 centimeter right to the measurement tape. Moving on to the xiphoid process, we perform the same process as before with the sternal notch, and we ask Gurjan to landmark, and I ask if there's any pain or discomfort, just let me know, and as we measure, we get 1 centimeter to the right of the measurement tape. Moving on to the navel area or belly button, I ask Gurjan if he can landmark that area for us, and as I measure, we obtain 2 centimeters right of the measurement tape. Moving on to the pubis area, ask Gurjan again if he can landmark that area for us, and as we measure, we obtain 2 centimeters right to the measurement tape. Moving on to the pelvis obliquity, as I tell Gurjan to put his hands on the iliac crest, we get 2 centimeters superior to the right side. Moving on to the sagittal plane again, with the condition of Gurjan having 1 shoe on, we go to center of pressure, so I ask him to move to his heels, then to his toes, and to relax fully, and we get slightly anterior. Moving on to the ankle joint, I ask if I can landmark the lateral malleolus, and I obtain 9 centimeters posterior. Moving on to the knee joint now, I politely ask Gurjan if I can find the knee joint and landmark, and as I measure the knee joint, it is 10 centimeters posterior to the measurement tape. Moving on to the hip joint now, I ask Gurjan if he can landmark his greater trochanter, and as we measure, we obtain 3 centimeters posterior. Moving on to the lumbar region again, I ask Gurjan if he could pull his t-shirt in front of him so I can get a better view, and I obtain 10 centimeters posterior. Moving on to the shoulder joint, I ask if I can politely landmark, and as I measure, I obtain 4 centimeters posterior. Moving on to the cervical region, as I measure, I obtain 9 centimeters posterior. Moving on to the pelvis attitude, we perform the same task as before, and we obtain that it was neutral position. Moving now into the frontal plane, we're performing the center of pressure task, and we perform the same process as before, and we obtain neutral position. Moving on to the chin area, as we measure, we obtain 2 centimeters right to the measurement tape. Moving on to the sternal notch, I ask Gurjan if he can landmark, and as I measure, I obtain 2 centimeters right. Moving on to the xiphoid process right now, I ask Gurjan to landmark, and as I measure, I obtain 2 centimeters to the right. Moving on to the navel or belly button area, as I measure, I obtain 3 centimeters to the right. Now moving on to the pubis region, I ask Gurjan if he can landmark the hardest part in that area, and as I measure, I obtain 4 centimeters right of the measurement tape. Moving now to our final assessment with Gurjan, we're going to be going back to our pelvis obliquity, so I'm going to ask Gurjan to put his hands on his iliac crest and point outwards, and as we can observe, the left side is 5 centimeters superior to the right side.
Hi, my name is Brar, and I'll be breaking down my client Gurjan's postural assessment and how it changed the conditions by making him wear 1 shoe on the left foot change to standing posture. When observing him from the sagittal plane or on the right side of his body, we can see that the heel of the shoe has caused Gurjan to lean considerably more forward than when he wasn't wearing shoes. This has caused the center of pressure to go from neutral to more anteriorly towards his toes. This caused certain measurements such as the ankle and knee joint to be further back due to his upper body leaning forward and being in front of his lower body. When observing Gurjan from the frontal plane or front view, we can see that even without shoes, he has slight imbalances in his posture. With only 1 shoe on his left foot, each of these imbalances were exaggerated further. Every one of his measurements, excluding pelvis obliquity, were found to be 1 or 2 centimeters even more towards the right of the midline. His pelvis obliquity also went from 2 centimeters higher on the left, all the way to 5 centimeters. This is due to the shoe raising Gurjan's left side higher. His body overcompensates in order to stay balanced by leaning towards the right and raising his left hip. Hi, my name is Dr. Brar. In this video, I perform an active and passive mobility assessment on my client Jacob. First, we test his right hip range of motion with knee and ankle relaxed. I make sure he is in a supine position on his back. I asked him to internally and externally rotate his leg at the hip so I can landmark his hip at the greater trochanter, making sure I ask for consent before touching my patient. I reminded my patient to keep his back straight and his left leg on the ground before I bring his right leg into flexion at the hip as far as I possibly can. Once I start to feel the end range of motion, I keep the leg there and use my goniometer to measure the angle, which in this case was about 122 degrees. Next, we test his passive ankle mobility with his knee and hip relaxed. I get him into a standing split stance as opposed to kneeling because it was more comfortable for my patient. As I am testing his left foot, I get him to lean as forward as possible while keeping his lead foot's heel on the ground. I ask my patient if I can landmark, and then I place my hand on his lateral malleolus so I can measure the angle, which in this case was 39 degrees, with my goniometer. Now I test my patient's active hip mobility once again with his knee and ankle relaxed. I get my patient into a supine position, then ask him to externally and internally rotate at the hip so I can landmark. After asking for permission, I place my hand on his right leg's greater trochanter. This time I ask my patient to bring his hip into flexion by himself, using only his lower body's musculature. Once he tells me that his leg is as far towards his chest as it'll go, I measure the angle using my goniometer. Throughout this procedure, I make sure to ask my patient if he is experiencing any discomfort or pain as he is recovering from a previous injury. I also had to remind my patient to keep his left leg on the ground as I noticed it was starting to lift halfway through the movement. The angle measured ended up being 95 degrees. Finally, I measured my patient's active ankle mobility. Once again, I test his left foot with knee and hip relaxed. I get him into a standing split stance and I remind him to keep his hand on his hips and not to lean forward, while also keeping his heel on the ground. I landmark the lateral malleolus after asking for permission. I asked him to drive his knee as forward as possible using only his lower leg musculature. The angle after measuring ended up being 30 degrees with my goniometer.
When taking a look at the client Jacob's passive versus active mobility, it is clear to see that there is significant discrepancy in the achieved range of motion in the two mobility assessments performed. When looking at the assessment of the right hip joint that was done with the knee and ankle relaxed, it can be seen that when performed passively, Jacob achieved a substantially higher range of motion that was measured to be 122 degrees of flexion, whereas when performed actively, the range was limited to only 95 degrees, a drop of 27 degrees overall. When looking at the ankle assessment that was done on the left ankle in a split stance, it was once again observed that the passive mobility test showed a vastly larger range of motion at 39 degrees of dorsiflexion, whereas when assessment was performed actively, only 30 degrees of dorsiflexion were achieved by Jacob.
When considering the case of 73-year-old Georgia, who just underwent a procedure to have her right hip replaced, only one of the two assessments that were done on Jacob would be appropriate to conduct on Georgia. That assessment would be of the flexion of the hip, more specifically the flexion of her right hip, which she has just gone replaced. Ankle dorsiflexion assessment that was done on Jacob will not be of importance, as it does not have an implication when considering that Georgia is concerned about how her hip will perform when she begins to become active once again. The hip mobility assessment would allow Georgia to get an idea of the range of motion that she is now capable of with her new hip both passively and actively. This assessment, depending on the result, would help alleviate some of the nervousness that she is experiencing. If we're to go positively, in the way that she has a large range of motion, it would allow her to be more confident when going back to becoming active. If we're to come out negatively and have a lower range of motion, it would possibly increase the nervousness that she's currently experiencing when going back to being active.
Hi, I'm Aujla, and today we'll be assessing Raj on his balance and joint stability using the Y balance assessment. In this assessment, Raj will be asked to keep his standing foot still and reach in the anterior, posteromedial, and posterolateral directions. Starting with anterior, when Raj reaches, he gets 70 centimeters. Next, onto posterolateral, in which he gets 85 centimeters. Now moving on to posteromedial, where Raj gets 72 centimeters. Now moving on to the range of motion assessment that we chose for Raj. In this situation, we chose a hip flexion actively with the knee and ankle relaxed.
As I approached Raj, I asked for permission to kindly landmark his greater toe canter. While doing so, I asked him to kindly wiggle his leg, and once it is located, I get the goniometer set up so that I'm able to measure. As I do so, I ask him to flex his hip actively while keeping his knee and ankle relaxed. Once he's at his endpoint, I measure the angle that he creates, and it comes out to be 92 degrees.
Hi guys, my name is Masih, and today we'll be assessing Raj on his Y balance test. And so for the range of motion, we chose an active hip range assessment with the knee and ankle relaxed, hip flex. We chose this because we felt that Raj was restricted in the posterior medial section, and we wanted to see if that was the reason why. So that's why we performed the hip range of motion test. We also performed this actively because the Y balance test is also actively, meaning that we will be gaining accurate information on the test. We feel that the range of motion test was able to understand Raj's Y balance results more efficiently. The range of motion test showed that Raj had 92 degrees limitation within the hip flexion. This shows that why he had 72 centimeters when we measured for his posterior medial section. We feel that within the range of motion test, if he had a greater range of motion, he would have had a greater reach as well in that section.
Hello again, I'm Gurja, and I'll be assessing Raj on his communication skills during his role as a presenter. I feel that the thing that hindered Raj's performance in his role as a presenter was his control of his pace throughout his presentation. I feel that at some point during his presentation, he had a pace of speech that was hard to follow due to being quicker than normal. These changes in pace were somewhat distracting to the points that he was trying to get across in his presentation. When looking at possible ways to improve on this in the future, I would suggest that Raj consider either shortening or paraphrasing the dialogue that he's trying to get across, so that he's not forced to rush himself to stay within a certain time slot that is allotted in the presentation section of the video. This will allow him to maintain a constant pace that would be easy to follow and also comprehend.
Hey guys, my name is Jacob Masih, as you already know, and today we'll be assessing Gurjat within his communication skills within the presenter role. So overall, Gurjat did an amazing job. He was very attentive, informational, and giving great anatomy terminology, talking about the hip, ankle, dorsiflexion, hip flexion, of course, talking about the range of motion with the degrees. He was very attentive, and within question 2, talking about George's case with it, which is very important within the clinic to talk about what has happened in the beginning and what can lead to in the end. Talk about her mental state and physical state, which is very good, and he showed a great relation to my assessment. Another thing that was very good that I would like to talk about is that he was very attentive and with his voice, and exaggerated his voice to keep the viewer engaged. What he could have done better was in question 2, he could have moved his hands in more or even put a video to keep the viewer engaged. But overall, great job. Thanks.
Hi, my name is Brar, and today I'll be giving feedback for Jacob Masih's presentation. One thing I felt that really hurt Jacob's presentation was his use of verbal graffiti. He would often use words such as or ah in between sentences and ideas while presenting. I think that this really hurt Jacob's presentation because it would make him seem unprofessional, and most listeners would probably question his credibility because of this. In order to prevent something like this in the future, I would recommend that Jacob use a script and practice beforehand before presenting. This way he would have everything he needed to say memorized, and he would no longer pause and need to think about what he needed to say next. This would also save time, as he would no longer need to pause during the presentation. It would save valuable seconds. It would just make his presentation seem more professional overall.